saw Dr. Harris for a problem called pelvic organ prolapse, and the organ that was prolapsing was my uterus. The symptoms I was experiencing, really, there was not a lot of pain, but I had a lot of discomfort, and as time went on, the prolapse became so severe that it was difficult for me to empty my bladder. So that meant that wherever I was constantly trying to be aware of where the restroom was. When I first met Dr. Harris, I felt very comfortable with him. He knew exactly what my problem was. After an examination, we talked about options, and he allowed me to choose the option that was best for me. Of course, there's always testing before any surgical procedure, and the testing that I underwent involved a bladder study, which it's not a painful test. Of course, it was done in his office and didn't take very long. They are so kind and sweet, and just are very understanding. The nurses give you hugs, and it's just a really special place. After Dr. Harris and I discussed my options, the option that I chose was to have surgery, and for me it was laparoscopic, and it meant a 24-hour stay, an overnight stay in the hospital, and that's what we did. My recovery time was amazing. After 24 hours in the hospital, Dr. Harris sent me home and said, "You can go shower." I had no sutures. They send you home with just surgical tape, which of course means that there aren't suture scars, which is wonderful. And in 10 days, I was back at work. I did go home with the pain medication, which I did take for the first couple of days to help me sleep at night, and then maybe one a day for about 3 days, but the pain wasn't severe. You know, your body can tell you what you can do and what you can't do. He told me that I could drive when I felt like it, so that's what I did. So in about 4 or 5 days, I was driving my car and just felt really good. My surgery was completely effective. The problem that I had been dealing with for quite some time had been resolved, and I feel wonderful. Dr. Harris, when he visited me in the hospital after the surgery, he said, "You're going to be so happy," and he was right. I am. If I could speak to the women who even think that they're having a pelvic organ prolapse problem or any pelvic issues, make an appointment. They will get you in very soon. Talk to Dr. Harris or Dr. Spites about your problem. They can help you. There is help here in Jackson, Mississippi for women who have pelvic floor issues, and there is an answer.